Okay, I'm going to go ahead and start. I realize that sometimes it takes a while for people to even be able to connect on the WebEx for these meetings, and so I'm pretty sure that as we're beginning, there's still people who are coming online. But it's my pleasure to welcome you all to our weekly update on the work here at the Milken Institute School of Public Health on the COVID-19 pandemic. And I wanted to start by just saying hi to everybody from the school. It's a pleasure to have you joining us. I want to remind you that we're toward the end of our semester, and all of that means for all of you, whether faculty, students, or staff, but also we're looking forward to commencement. We're planning to hold our commencement online, and I think that Stacy's team has been reaching out to all of you about that, I ask you to make sure that you're checking your emails, that you are responding. We want to make sure, especially those of you who are graduating, that each and every person is recognized and honored in the event that we're putting on online. And so please look for that. If it goes into your sometimes for me, it goes into my updates mailbox or some other mailbox with the Gmail, that you pull that out and take a look at that. And so it's my pleasure today, though, we have a very special topic today, which has to do with our volunteer task force. And many of you know that we had put out a call for volunteers a few weeks ago in terms of our school being able to play a role in helping to combat the COVID-19 virus and the disease that has been spreading across our country. And we had an amazing outpouring of support from our community. And I have to thank each and every person who either stepped forward to volunteer for us or have done many other things to volunteer in their own communities or even on their jobs, have been working to defeat this epidemic. There's nothing more important than all that we have in prevention in particular. We know that the efforts of people who work in the ICUs and take care of people on the ventilators are heroic efforts, and I completely support those efforts. But we also know that half of people who go on a ventilator are going to die. And we don't want people on the ventilators. We don't want people having to wind up in the hospital in the ICU. We want to prevent the spread of this disease. And everything we've done since we sent people home and went to online teaching has helped to contribute to that. But now we are finding ways to contribute in other fashions. So what I want to do, without further ado, is introduce the panel that we have with us today. I'm very pleased that 3 of our faculty are among the faculty who have been working on this in very much a voluntary fashion. And I'll give the opportunity actually to introduce themselves. Remind the faculty that your mics are live. Do not rattle papers or make extraneous noises because that creates feedback online. Gene. Dr. Migliaccio, I'm going to start with you to introduce yourself. And then we'll have the 3, and then I'm going to start asking questions.
Great. Thank you, Dean Goldman. Once you know it, and I'm glad we're amongst family with our GW community and School of Public Health. But once you know it, my German Shepherd decided to make a visit and bring his treats in. So my apologies. Greetings, everyone. I wanted to introduce myself. I'm Gene Migliaccio. I'm the Associate Dean for Applied Public Health at the school, and also serve as a professor in global health, and been part of the school for a number of years before I came full-time last August. And it's quite an experience in terms of working on the COVID-19 response. And I just have to tell you, I'll start really quick, but I'll turn it back over to the dean and my colleagues. But when right around the springtime, before we went into that spring break, with COVID starting to ramp up in communities throughout the United States, And prior to the students going back home for spring break, we got a call from the safety and security side of the house, the folks that oversee the Colonial Health System. They wanted a couple of volunteers to answer telephones. And so we went out through social media to our public health students, and we just needed a few volunteers. All of a sudden, 47 volunteers kind of raised their hand and said, I'm available. We realized that there was an appetite for volunteerism with our population. We had so many volunteers that we couldn't use them all. But when the dean wanted to take a leadership role in the community, and she asked us to start an entity. We didn't have a name, but start an entity if we could call out for volunteers and see how we could assist in the community. So the old adage goes, if you build it, people will come. And so we started to build it with, you'll meet Professor Amita Vyas, Dr. Vyas, she's on the line, and she was part of our leadership team to conceptualize, as we call it today, the Volunteer Task Force, the GW. It was the School of Public Health Volunteer Task Force, and then it turned into the GW Health Volunteer Task Force because we joined forces with schools of nursing and schools of medicine. We initially were looking at third and fourth year medical students, and lo and behold, we put the call out, and we started to build slowly in terms of a couple hundred volunteers, faculty, students, and staff, 300 volunteers, up to 500 volunteers over time. And we had no mission at that. We were building it. We were building structure. We were looking at how to organize ourselves, and having communications with our community partners in the departments of health in DC and Montgomery County, Prince George's County, looking in Virginia, Alexandria, and Fairfax, Loudoun County, believe it or not, and then some of the national associations. And then the work started to come. So people started to get interested. The COVID-19 was not really present as we see it today in the community, and everyone was ramping up. And as organizations started to ramp up, we became part of their plan to support their efforts. And you're going to hear some amazing stories today from some of the volunteers, your colleagues that are out there working in various county health departments right now, and some of the other work that we're doing for national associations. Much of the work can be virtual, but some is on site, and we'll talk more about that today. But that's my opening. I'm just happy to be here. Thank you.
Thank you very much. Dr. Vyas, you were one of the first to raise your hands when the call went out for volunteers, and you've been involved in this since day zero. And maybe you could tell us a little bit about yourself and your background and why you step forward and what you've been up to.
Yeah, thank you, Dean Goldman. Hello, everyone. I'm Amita Vyas. I'm an associate professor in the Department of Prevention and Community Health. I also have the privilege of directing our MPH program in maternal and child health. Almost all of my work is focused on women and adolescent girls, both here in the US and around the world. And I think, like so many of you who are part of the GW public health community, when this pandemic struck, we felt there was a need and a call to service. And, I had the privilege of connecting with Dean Goldman early on, and I think I sent her a text message and said, I'm not an infectious disease expert, but I know that I can be of help. So whatever it takes, I'm willing to give my times. And I'd like to thank Dean Goldman for her leadership, as Gene mentioned, to very quickly reach out to the community, knowing that, one of the things about our school in particular is people's sort of compassion and commitment to working in the community. And we saw that. I think, within a few weeks, we had several hundred people who had signed up as volunteers. And, this was students, staff, and faculty, all of whom have so many other responsibilities on their plate. And they wanted to use their public health skills and expertise and knowledge to help in any way that they can. So it's been an incredibly inspirational journey over the last 4 to 5 weeks. I'm inspired every day by our volunteers who are continuing their full-time day jobs as well as their schoolwork and academics and still going out there, either working remotely or going out into our Montgomery County Health Department site or Prince George's County Health Department site, and willing to do whatever it takes. I think it speaks volumes about both our GW School of Public Health, but our public health community in general.
Thank you so much for that. Karen McDonald, Dr. McDonald.
Hi, good afternoon, everybody. All for taking the time out of your own busy schedules to come and join us and hear about some of our efforts and how you too could get involved. As Dr. Vyas and as Dr. Migliaccio and Dean Goldman have said, we're in public health. This is what we do. And this is, for those of you who are students that are online, this is what we're training you to do. This is public health in action. Those of you who are in my program evaluation course or who have worked with me know that we develop our toolbox so that we are ready when any situation presents itself, that we're ready to take action. And that's where we are today. We need to be serving where we live in the communities where we are needed. And that's exactly what we're doing in Montgomery County. It is the community where I live. And when that call came out to serve, there wasn't a moment of hesitation. And I couldn't be prouder of the GW community. And as Gene has said, we have so many people who want to serve and want to be useful. And this is a time when we are needed. So it's our call to serve. Thank you.
Thank you. And I think that's how I feel as well, that to say the least, this is a pandemic of a lifetime. This is the biggest public health issue that of my entire career. And I think there have been other times when we've thought that we might be facing something of this magnitude, but then weren't, and were able to stand it down. But now here we have something that I think is going to be a very significant part of, for all of us, of our life experience. It's going, our lives up to this point in time are completely different than what they're going to be from this point forward. And what we do to contribute is going to make not only a difference in the world, but it's going to make a big difference in shaping our careers. Even somebody at the stage of a career that I'm at, I can feel the changes that are occurring because of being engaged with this. But I'd really like to hear from the three of you what the experience has been like in, not only recruiting our volunteers and especially, our students and faculty who are volunteering, but then what the situations are that they're finding themselves in, as they're actually getting involved, and I'm thinking right now, especially the two suburban DC metro counties that we're involved with, Prince George's and Montgomery counties. Dr. McDonald mentioned she lives in Montgomery County. I'm also a resident of Montgomery County, and it does feel like, helping to protect one's own home. Montgomery County also holds the entire National Institutes of Health. PG County has the Food and Drug Administration. These are critical resources for the nation's health and safety. And so it's not just our own health, but significant assets that in our agencies that are highly sophisticated, scientific agencies, health agencies. But what do you see actually when you're getting involved with working in public health in those counties? And how are you able to, contribute, you and the students that you're working with? And maybe to just take it in a different order, starting maybe with Dr. Vyas, Amita, to tell us your experience.
Yeah, thank you, Dean Goldman. It's certainly no secret that the public health infrastructure here in the United States is not perhaps what it used to be. And as events have unfolded over the last 6 weeks, And in the months and years to come, we will look back to figure out, what happened, when, what went right, what didn't go right. But certainly, the public health leadership and infrastructure in our country has failed us in many ways. And, I will say that as somebody who's gone out now into the county health departments with our volunteers, the need is great. There are incredibly committed and smart public health workers on the front lines in both of these counties. And yet without the resources and capacity that they need to really, both in this mitigation and then hopefully in a containment phase of this virus, what they need is simply not there. And so in many ways, that is, it's unfortunate and it's sad, to think that this is where we are with our public health infrastructure. And it's my hope that it'll inspire our next generation of public health workers to take on this effort and advocate and to ensure that that is not the future of the public health workforce and infrastructure. I think that's opened up everybody's eyes. And at the same time, it's presented as Dr. McDonnell said, a once in a lifetime opportunity for our students. As they're going out there into the health departments, they are being trained to do case investigation and contact tracing. They are being asked to help serve in testing sites. They are being asked to provide their technical expertise around looking at case report forms and screening forms and designing databases and really thinking about how to have a more integrated data system. And, I think we know that there are certain things that have worked when it comes to epidemics like this. And so we've got to bridge both traditional public health practice with new innovation and technology. And I think what I see every day is sort of many of our young volunteers who are out there who've got new and innovative ideas for how we can, work on contact tracing and case investigation and new databases. And so they are getting real public health work. It's on the job training, and we need the capacity and we need the help. And that is in this moment of so many negative things happening, that is the moment of sort of positivity, and that's the moment of hope for the future. Karen, would you like to jump in? You've been in Montgomery County quite a bit and sort of sharing your experience.
Sure, and one of the things to sort of piggyback on what's been said is when COVID-19 hit, and we've been working with the health departments around DC for a number of years through our practical experiences. So the people there weren't strangers, and so they knew that they could trust us. And they could trust us with the emotions also that they were feeling. You could feel the stress that was going on, because here they were being faced with contact tracing that was developed for a respiratory illness, and it's changing every day. We see that symptomatology changing. So one, what we call line list has to be regenerated because we start hearing changes. And so not only do they need to be nimble, we're being nimble and helping them out. And so when we first started, you could sense a lot of urgency and really trying to figure out the landscape. And so we helped them to do that. The good thing is that we listened to them. What did the health departments need? Because we didn't want to overwhelm them. And now we're about a month into working with the health departments. And I can say this morning's level of stress has really come down. We are there. We are taking action to deploy our students into those tasks that Dr. Vyas talked about. Things such as, you think about Maslow's hierarchy. We would love to be doing this high-end analysis, but we can't until we get that data. So our students are really helping to decrease that noise, decrease that stress, so that the people in the health department can move forward and develop responsive programs. Because when we first came on board, there was a lot of backlog. And so it was hard to move forward until we could clear that away. We can clear the pathway, and we're really seeing that take a lot of traction now. And it's really due to really finding out what's needed and how we can best meet those needs. And we're also seeing the health departments reconfigure their staffing so that they can meet those needs. So the things we talk about in class, such as task shifting and task sharing that we teach our students, we're seeing that in action and how important that is to come together, because this is, we're learning as we go along. And it's an incredible experience, and it's one that you got to be nimble, and you got to keep moving forward, because we're seeing that there are dramatic changes being made. So thank you.
You're reminding me of one of the things that I love about our faculty, among many things, but that you guys are not only brilliant and you're great researchers and scholars, but many of you, have anchored yourself in the real world of public health at different points in your career. Even if now, in being involved in this task force makes an enormous difference in the classroom. That when you're teaching the theory and when you're teaching the competencies, that you're connecting that to knowledge about what it takes to actually apply that in practice. And speaking of practice, of course, Dr. Migliaccio, as our Associate Dean for Applied Public Health, is kind of our practice expert and somebody with a considerable experience in the practice and management, really, of health programs in the federal government. And you have been not only helping us to coordinate this with the Maryland counties, but there's some work that we're doing in the context of the District of Columbia. And we're even having discussions with the National Association of City and County Health Officials, the NACCHO group. Maybe you could tell us a little bit about those two things, DC, the NACCHO, what some of the opportunities are there for us, but also ways that we can actually help on a broader level.
Yeah, certainly. I wanted to let me just I'll give you an update on NACCHO, and I'll talk about the DC government. So let's start with NACCHO. We were so fortunate. We have a relationship, a strong relationship with the National Association of County and City Health Officials. They represent, they call them member organizations, but they represent about 3,500 state, local, and county city jurisdictions, health departments throughout the United States. And they came to us immediately. They created a preparedness office. They focus on preparedness, but they created an office just for COVID. And believe it or not, it was staffed by one of our DRPH students in environmental and occupational health, which was phenomenal because she was a student of mine, and that was our point person to come in, and she laid out the ask. And the ask was, could we pull together a number of volunteers, and we pulled about 13 folks in to work, as we're still working the project, to look at all 3,500 health departments throughout the United States and tell us what their response is. We need to find out the points of contact. We need to find out exactly what they're doing for their communities. And this information was being shared with Health and Human Services. So it was moving up chain to the federal level. So the National Association was actually providing detailed information, and our students are working the project. It's a detailed project, a large database. First thing we got was just a massive. We saw all their members, and here they are. And then we took a look at it and made recommendations for different fields to make it a little tighter in terms of the information that was going to come at it. So that was that's been an interesting. That was our first project because we had worked with. We're continuing our development with our health departments. Speaking of health departments, the second area I'd like to just chat about is the DC government. We have a couple of our epidemiology professors that are embedded into the department, provide a tremendous amount of expertise. The district government is, and we have been chatting with them, and right now they're looking to put together a contact tracing investigation and care coordination program. Similar if you see what's going on in the country right now, there's the state of Massachusetts has engaged. They've put about actually about $40 million on this project, working with an NGO that does some global work called Partners in Health, and some of their academic institutions in Massachusetts and their state health department building a very robust contact tracing program. New York is following suit, and with some philanthropy from Michael Bloomberg and Johns Hopkins School of Public Health, building out the frame, and then working with the state health department to also look for contact tracing. The district is at the same juncture right now. They're looking to build out a really robust contact tracing program. I can see it being a virtual program initially. There'll be some care coordination with the patient population. Our proposal back to the district is we'd like to start with our students, our public health, nursing, and medical students, to start working on a virtual platform for the district to be followed up long term, because this is not going to go away in a couple of months. This is long term in terms of the contact tracing, where we could bring on some folks from the community to engage with the population. And this is just right for the work we do with community health, public health. It's just ideal. I just want to just back up a little bit, Dean Goldman. I want to tell you, I spent 35 years in government, so this is probably one of the first times there's been a national incident in the country, and I haven't been engaged. But I've been living through my daughter, who's a public health officer, so she feeds me every day in terms of what's going on when she works over at Health and Human Services, and she's also a graduate, an MPH grad from GW. But I had an opportunity in my career to focus on work at Ground Zero, a lot of work in the Pacific with migration, immigration issues, and then I focused a lot on Katrina and building, taking care of a population of about 200,000 evacuees, refugees, if we want to call them, from New Orleans that went into Houston. So I was assigned to Houston. It's always interesting because when you're involved in these kind of exercises, it's kind of a surreal experience, because you go from home, which is relatively calm, to an area that's been disrupted, and you find yourself in the middle of an operation. This case has been different. I mean, every state is engaged with COVID response. So there's we're living this right now, and being a public healther, it's something that is just awesome to engage. So part of the ask today is for our folks out online, if you haven't volunteered, we'd love you to volunteer. We'll have some work for you and some engagement. We have, for some of our folks that are MPH at GW, we're actually looking to help individuals that were in the midst of a practicum and hoping to graduate this calendar year, to offer some opportunities to fulfill practicums that have been disrupted with virtual assignments. So I want you to think about that. We can certainly chat about that a little later. Thank you.
Thank you so much for that. May I ask a question to all three of you? What kind of skills are you looking for among people who might potentially be able to volunteer?
So I can jump in, and then Karen would love for you to add more, but really, really important skills are people who are willing to step in and take some initiative when they're on site and can adapt. Sometimes we have to move from task to task. Interviewing skills, as we're doing case investigations, that is really come up as such an important skill, like being able to get on the phone and talk to people, some who may not even know already that they've tested positive for COVID. Some, unfortunately, and we had this, this happened this week with us, by the time you make that phone call, sometimes a person's passed away and you have to talk to a family member. And so we are providing that training. Our faculty is providing that training on interviewing skills and doing that case investigation. But certainly if there are volunteers out there that either have those communication skills or have been trained in qualitative interviewing or patient interviewing, that is of huge significance and is of great value to our health departments. People with database management expertise is another really big one. We're going to actually be working to help create new database systems to analyze data in real time in both the counties that we're working in. And so having volunteers who have expertise and can assist. We've got amazing faculty leads on all of those projects. And so volunteers who also have those skills are all would be very valuable. Karen?
Sure. In Montgomery County right now, our day-to-day volunteers, exactly as Dr. has said, being nimble, being flexible, because we kind of don't know sometimes day-to-day what's going to be needed. Anything from sorting faxes, and I'm not kidding, faxes, to entering data, to doing contact tracing. The interviewing part for Montgomery County, as was mentioned, is very intense. So the school nurses in Montgomery County are actually now taking that part over. But there are a number of volunteer efforts through the what we call the Medical Reserve Corps in the state of Maryland that everyone can also sign up for. And in that way, you get detailed right from the county where you're living in for other efforts, such as there's going to be testing sites that are going to be set up throughout Montgomery County. And they're going to be needing people to funnel traffic. So can you stand and wave your left arm in one direction so that cars go in the right way, to a clipboard to make sure who's being seen. You're not actually necessarily going to be running the test, but you're going to facilitate professionals being able to do their job. And that means everything. And that's what we're here for. So what we're looking for right now is, people who can be nimble from the data entry. And then once that data is in there, running the epi curves, running those analyses where we can see how the infection is changing or where the disparities are. And that's where we need volunteers at this moment.
Yeah. Thanks, Karen. I just want to jump in also. When we went out with a call for volunteers, we asked for a number of skills that you felt comfortable and that you could assist us with. And we broke those into 4 areas: administrative, technical, clinical, and preparedness. And you come to us, the students come to us, and our faculty and staff with an array of expertise. The largest skill sets that we picked up, everyone feels comfortable. It was the number 1 and 2 in terms of interview skills, interviewing people, and data entry and management. Those were the top 2. But we also find we have a lot of our team members that have actually worked in preparedness. About 34% of our respondents out of 500 had some project management skills. That falls in preparedness activities. And we had some technical skills too. People that have actually done some contact tracing. 43% of our respondents said that they actually have been engaged with contact tracing. But the neat thing about what Dr. McDonnell just mentioned is that the way we built our volunteer task force, we have a faculty lead at each site because we believe that this is a learning environment. We want to create those learning communities. So our not only our faculty members are providing training, because they're actually providing some training and technical assistance and consultation to the health departments, but they're also providing that educational and training to our own volunteers. So this is learning on steroids right now in terms of what we're doing. So phenomenal opportunities, and hats off to our faculty leads. They do a great job.
I think that's.
Gene, sorry.
Yeah.
You were going to
I sort of bounce from that because what you're talking about. So we talk about preparedness to have job action forms. I just want to let you know, Gene, exactly. In Montgomery County, they didn't have job action forms for what we're doing. So we're working with our students to actually develop those job action task lists and those forms so that people know like what process needs to be followed in this type of response. So, thanks for that shout out. This is definitely a learning opportunity as well.
So I did want to point out that there is a Q&A area where you can enter questions, and there's also a little chat chat area. But I think we're using, well, I see there is something in one of the chat. There are a couple things in the chats. And there are a couple of things. I think that we may have already, Giovanni, I think we may have already answered your question that yes, non-trained students can definitely get engaged in this. So that I think that emailing us is the way in, and I think Gene is listed in the GW directory. Gene, if you want to, in a minute, maybe we can put into the chat window actually one of you the email address that we would like people to use if they want to reach out. And then I think Liz Borkowski asked whether in the local efforts that if there's information that's being collected that might be useful to others. We certainly are thinking about this, that there's a lot of workforce efforts around the overall pandemic that have involved, for example, our Healthcare Workforce Institute that's been thinking about, okay, if you have to have a ventilator, what kind of healthcare providers do you need to have to manage a ventilator? The intensivist, the respiratory care nurse, the respiratory therapist, all the people that you need to be able to have on site to successfully treat somebody on a ventilator, right? What we're learning, I think, through doing this is really what is the FTEs we need. And those of you who follow the press will see the estimates for how many people that we need to have across the country for contact tracing and for also the lab testing are all over the map. And that's partly because it's probably extremely variable place by place. One, it's probably very different to do contact tracing if you have a lot of people packed into a very small area where you can send people around to find those people or call them and get them to come to one central location. Then, for example, if you've got a spread out community where maybe people think they're at lower risk for the COVID-19, but doing contact tracing could be much more labor intensive because people are really far apart. So I think, Liz, you're making a good point that we could begin to start contributing to that sense of, what is the workforce? How many people do you need? What kind of skills do they need to have? I mean, the other thing that's been very much, I think, on everybody's mind in terms of the policy issues is the fact that, like so many healthcare issues, this problem is disproportionately impacting poor and minority populations. And that seems to be happening for several reasons. We're still trying to understand this. There's probably less access to even care and testing for those populations. It's probably true that many of them are right on the front lines in terms of being in essential jobs that are having them being more in contact with the public. The people who are delivering our groceries, the people who are delivering food, the people who are continuing to work in essential jobs may be more likely to be low income, be minorities that not have you can't really, cook food via telework. It's also possible that, as we know, there are pre-existing conditions that make COVID-19 much more serious. And our testing is very much pegged on symptomatology still. And so there are a lot of mild and moderate cases that right now are submerged. They're the bottom part of the iceberg. What we know about is the tip of the iceberg. The people who get a test and they test positive, and or they're in the hospital, they're in intensive care, or they die, we kind of can count those. And even that, we're not counting perfectly. But the ones that aren't tested are people who have milder disease. And so if you have pre-existing conditions, it's probably more likely that you're ending up symptomatic, getting tested, getting hospitalized, ending up in the ICU, even dying. And of course, we know low-income and minority communities have more of these pre-existing conditions. So it's complicated, but I think it makes your jobs difficult in terms of just the cultural diversity of the communities to whom we need to be reaching out. And I was just wondering if you guys could comment about that. I know that I'm talking to a couple of people here among my faculty who are completely experts in this area. but how you address that with the volunteers and the training of the volunteers, and is that a consideration in terms of the kind of people that we need to involve, to engage in this effort? Karen, do you want to start with that one?
Sure. So that's precisely it. Montgomery County is incredibly diverse. So we've actually been trying to respond to calls from other clinics actually are looking for, people who are conversationally fluent in Spanish. Not that, just to help facilitate like I said, the providers providing the care, can we, with our database, find those volunteers that can help meet those express needs as they're coming along. So that's, that's rudimentary in what we're trying to do. But it is, a small step that hopefully that we can do with volunteers. But I know in Prince George's County that, Amita, you guys are dealing with a very much more diverse jurisdiction as well, if you want to talk about that.
Yeah, thanks, Karen. I mean, as many of you know, the number of cases in Prince George's County is skyrocketing. In many ways, it's turned into the epicenter of the pandemic in the state of Maryland. And, for all of us in public health, we know a lot about health disparities. We know about the history of institutional racism, in particular in the healthcare system. And, what this pandemic has done is to really sort of bring light to all of those disparities and the history of how minority communities have been treated by the healthcare system. And so, yes, we do talk about that with our volunteers. Luckily, many of our volunteers have taken some of our courses in health disparities and have worked on projects. But, I think that we have to be really cognizant moving forward. And as we even expand into other areas in our community, that, there is sort of the gold standard of what everybody's talking about on the news in terms of what we should be doing. But the reality is that we're working in some of these communities that are both poor and under-resourced in so many ways, and that have been neglected in terms of the healthcare system. And so I think it's also really important for us as volunteers, as we're walking in there, it's our job, we're working for them, and it's our job to be both collaborative and to build trust, which I do feel like we've really done. And to ensure that we're not walking in and sort of saying, well, I think you really need to be doing X, Y, and Z. And you're not doing it to the quality of what should be, what we should be doing and what we learned years ago with other pandemics. That is not how you build relationships with people in the community. And you have to really be sensitive to that. I think we've had some incredible faculty and students and staff working in both of these counties. And so we haven't had any issues with that. I think everybody went in, again, willing to roll up their sleeves and do whatever it takes. And everybody has been working side by side with county public health professionals, working side by side with our volunteers. It really is a team effort. But I think, as we grow and expand, we need to ensure that we're paying attention to the issues of these minority communities and the history here.
Thank you. I don't see any other questions in the chat box, so I'm going to move on with some of mine. And one question that I've heard from some people is, if they don't feel comfortable yet being able to go out and work, are any of the assignments that can be done by telework, can be done virtually? Can people do? Are there things that people can do to help? And maybe I'll turn to you for that, Gene, without having to actually show up.
Yeah. I believe, the work that we're looking at for the DC Department of Health for contact tracing and also for care coordination, actually checking on individuals that are self-isolating for those 14 days, et cetera. That's going to be all telephonic. So that's a virtual assignment. And if we start to move in that space with the DC government, and then we have discussions coming out with Alexandria, Fairfax, and we just heard yesterday about Loudoun County in Virginia. We believe that it's the same work. A lot of platforms in the United States for contact tracing now, they're looking at a virtual response. So you can be anywhere in the country and participate virtually, and we can set that up for you.
I mean, I know that Fairfax is like PG County, that there's been a lot of transmission there, and I think it's been the hotspot really for the state of Virginia. So I'm glad that we're able to reach out to them. I think that's important, and that is a part of our community. One of the things that I think that we're all aware of is that the population doesn't stay fenced in within the DC jurisdiction, that people live in one jurisdiction, they work in another jurisdiction, and then they go to the hospital and for medical care or have their babies in another jurisdiction. And oftentimes in families that you'll have everybody in the family during the day is in a different jurisdiction. One's in school in one place, one works in another, and the third one works in another place. And that's pretty normal in our region. And so it really is like one ecosystem in terms of for health and for people, but yet it's three different governments. And how is that kind of affecting the ability to do the work? I think, Amita, you may have heard more about that than the rest of us in the context of PG County, which is certainly very dependent on DC and the other regions.
Yeah, no, absolutely. And I, have others jump in as well. But I mean, we sort of constantly hear as we're, we found ourselves in this unique position where we are sort of, coordinating with the different counties. And so we're hearing what different counties are doing, and we're actually able to share that information. I think one of the things that's been, so great is the counties really do want to work together. And there is a history of that, either through the Council of Governments in the region, but also, all of the epidemiologists that we're talking to and working with in the different counties, they say they have shared how in the past, pre-pandemic, they did coordinate and they would share best practices. Now, the problem now is that sort of given everybody's time constraints and just sort of everyone trying to put out fires every day, they haven't had that. They haven't had the opportunity to coordinate. And so that's been really nice for our team, is that we've been actually able to share practices in one county with another. So if one county is sort of thinking about, oh, we really want to rethink our case report form, we're sort of saying, oh yeah, well, we've got faculty working in DC and Prince George's, and this is what they're thinking about doing. And the counties have been really open to us sharing those practices and those documents. And so, it is a hope that at some point that they will be able to collaborate, and hopefully we'll be able to play a role in helping to facilitate that collaboration, so that everyone isn't reinventing the wheel and everyone's sort of sharing resources and capacity in some ways. We've even had volunteers who are working in one county who are saying, oh, I'd also like to work in another county. And so I think, again, just very organically, we're going to be able to play a role of being that messenger and sharing of information. But the good thing is that everybody wants to do that. Everyone wants to share information. There is, with this pandemic, people are checking the egos at the door and want to work together and to collaborate for the common good.
So we're kind of, heading toward the close of the session. And one thing I thought that would be really interesting for those who are tuned in is, given the experience that the three of you have, what to share your thoughts for, what do you think are the most important points for not only slowing the spread of COVID-19, but also for society to kind of move to the next phase as we start to reopen our economy. I think we all realize that the economic impacts of everybody being at home and closing all non-essential businesses is having a major impact on health as well. We appreciate that, and we're happy that lives are being saved from the COVID-19, but we know that then there are other risks that are starting to emerge that are also really important. So I thought I'd give you each kind of a chance to reflect on that, and maybe starting this time with Karen McDonald, Dr. McDonald.
Thank you. That's a really good question. I think one of the things I see moving forward is we need clear communications. I think people are hungry to know what they can and cannot control. And to have so many different messages day to day changing from leaders that they're looking to has been a disservice to what the public can actually handle. We see other leaders being able to really bring their population together because this is a common good and people want to know what they can do. As we see it with our volunteers, what can people do to control what's happening so that we can then put our attentions toward those who really need us. You know, as we've been seeing, and I know Dr. Vyas, you've been part of this, we are seeing vulnerable groups becoming even more and more put behind. We've got increasing rates of child abuse, gender-based violence. And if we don't come together to help, you know, to sort of make sure that people can get that care, then we're going to put people farther and farther behind. And we don't want that to happen. So what is it that we can do to have clear communications where people have a direction and have something that they can do to give to the greater good? But we also need to make sure that we have agencies in place that are taking care of their populations so that they can do their jobs. It is real. People, you know, the lines to get food are real. How do we coalesce that leadership to make sure that people have their basic needs met? And that's where, you know, that's my hope of coming out of here, is that maybe GW starts that clear communications. We're being that conduit of information between different jurisdictions, that we can learn from each other so that we can best meet the needs of our population.
Thank you for that. Amita, Dr. Vyas?
Yeah, I mean, I agree with everything that Karen said. I mean, we've seen this uptick in both gender-based violence as well as violence against children. And with our social distancing measures, that's, put an increased risk on women and children in our communities. And so really trying to figure out, it's possible that we will go through phases of social distancing over the next year until we have a vaccine. And we need to really prepare for how we can provide services and interventions and communicate that to women and children who are in need. Second to that, you turn on the news and everyone's talking about tracing and testing, right? It's all about contact tracing, contact tracing, contact tracing. The reality is that many of our communities are not doing full contact tracing. And again, that's a resource and capacity issue. And if we were to think about the kind of capacity that's needed in this country to do that, if it's, one contact tracer per 500 people, that's an enormous army that one needs to train and to manage. And I think that we need to be really innovative and think of new ways of utilizing new technology, artificial intelligence that's out there, and creating better platforms. I think some of our more traditional ways of doing contact tracing might not work right now. And we are lucky that we do have new technologies and new innovations. So I think that, both public health and our technology experts need to come together to think of ways in which we can do it that doesn't compromise the quality and the human touch, but also facilitates being able to do this at scale.
Well, I can tell you, I think I'm looking at the faculty for our short course for contact tracing right here on my screen. And I'll help you. I will volunteer to help you with that because I think it's going to be extremely important that we are help with the training. Gene, Dr. Migliaccio, you get the last word on this.
Thanks. It's Karen and Amita did a phenomenal job. I hope not to sound like a broken record, but if I could just be a little more visionary and global, and I'll come right back down to it. But the time is now in public health in terms of this is not going to be over now. Our public health practitioners and scientists and experts are telling us that we're going to see another wave coming at us, perhaps in the fall. So the most important piece is study hard. Let's get you certified, smart, graduated, out in the field, working in the public space for the public good to make really a difference in the field of public health. I envision that with the reviews that we're going to be doing for the next, starting in months, we'll start to look at things we did right, things we did wrong, things that we're going to have to do to rebuild our infrastructure. And you're all going to be part of that as you in your careers. And more efforts will be placed upon state governments, federal government, to build a stronger public health infrastructure. Right now, the infrastructure has major cracks. And it's obvious in terms of what we've been witnessing. We've never seen anything like this. We never want to see it again. So I can just see it in terms of the area of from public health, workforce development and traineeship programs to bring more and more people into the field of public health, to ensuring that we've got a trained cadre of folks, and brings me down to contact tracing and investigations and care coordination. More and more individuals will become, as you think about it, those community health workers from that global speak that I live in. But community health, people that live in the community are going to be trained on how to do contact tracing. They're going to train on investigations and care coordination by people like you and me. And they're going to carry this forward, and public health will be a very, very popular program that the community will embrace because of this experience that we've all gone through. We'll carry this forward. What a better place to be to make a difference.
I cannot agree more. And I should point to the fact that we do have within our school not only experts in health communications and epidemiology, the lab sciences, but also we do have in global health a disaster and humanitarian assistance program that has faculty who, actually Dr. Migliaccio has been a part of that program. Other faculty who, like him, have been involved in their whole careers with response to disasters and experience with going in as to one community at a time. This is a little bit different. It's much more widespread, but the principles apply. I should also point out, I've given you a little bit of the background. I apologize that I think I sent you kind of an incomplete little comment that I probably ran out of characters in the field, but I did give you a link to our volunteer form that if people are interested in volunteering, hit that link, you can fill that out. And that gives everybody a chance to see that you're interested and available, and some information about what you might do. And I've also sent you Dr. Migliaccio's email. He is gino@gwu.edu. And although he's probably got a hailstorm, or maybe it's a blizzard of emails, nonetheless, he will triage your emails to the people who can help if you have questions. But certainly also, in the case of, for example, the Nashman Center, which is on the line, we would look forward to partnering with you, as we have with the nursing and the medical school and others. We even have students from the University of Maryland, our competitor, working side by side, being supervised by our faculty in this, because really this is an all hands on deck operation. And what's really important here is the results of it in terms of playing a role in protecting our communities. I want to thank you guys so much, not only for your presentations today, but your dedication to public health, to our students, to the communities that we live in. Thank you, Dr. Vyas, Dr. McDonnell, Dr. Migliaccio. I cannot appreciate you more. And thank you, Wendy. We look forward to working with the Nashman Center. Bye, everybody. Have a great week. Have a great weekend. Bye.